Hi, I'm Jessica Perlo. My journey with the foundation began this September, but throughout my career, I've focused on designing and implementing health system improvements. I'm grateful to have had the opportunity over the years to work with really incredible colleagues in our community, to lead efforts to promote workforce well-being and support clinicians to create positive work and learning environments that promote equity, meaning, and a commitment to deliver high-quality care. I'm excited to now lead the foundation on its path to foster the core values of medical professionalism as a means to improve healthcare outcomes for everyone. It's my privilege to now guide you through the strides the foundation has made towards its mission this year. Although our Choosing Wisely initiative has wrapped, it made significant contributions globally to shifting mindsets and influencing policy to reduce low-value care. Spanning more than a decade, its legacy continues to resonate. Guided by its success, our focus continues to be on building trust and recognizing the crucial role that trust plays in delivering quality healthcare. Our trust conversations create a space for engaging dialogues with respected healthcare leaders. This year, we discussed barriers faced by clinicians and patients, shared actionable insights for progress towards building trust, and explored the role that health equity plays in creating a more inclusive workforce to provide better care for all. Through our Building Trust essay contest, we gained powerful insights from future healthcare leaders about medical misinformation's reach and durability. 4 of the essayists were invited to speak at our annual forum and gave our participants a fresh perspective on how vital the role of trust, empathy, and effective communication is in healthcare. Their stories emphasize the need to understand patients' beliefs, dispel misinformation, address stigma, and foster shared decision-making to encourage mutual trust between healthcare professionals and patients. At the same forum, healthcare leaders explored the historical roots of mistrust inside and outside of medicine. Historians Louis Grossman and Sophia Rosenfeld noted that trust in medicine rises and falls along with trust in other established institutions, and the importance of being honest about and accountable for where we have created harm, and taking concrete steps to rebuild relationships with our communities. Dr. Giselle Corby shared in this historical review by discussing BIPOC community willingness to believe misinformation as being grounded both in this historical context and in present-day inequities. We explored the role of medical debt, eroding primary care and access, AI, and the need for bidirectional health information exchange as pieces of the path to address misinformation. We concluded our time together thinking about the importance of humility, empathy, and the need for collective effort, not necessarily in consensus or agreement, but simultaneous action to advance public trust. We're excited and energized to build off the momentum of this forum throughout the year and together at next year's forum. Finally, by collaborating with the Alliance of Academic Internal Medicine, the American College of Physicians, the Josiah Macy Jr. Foundation, and the Gordon and Betty Moore Foundation, we proudly funded several impactful programs dedicated to building trust through health equity and inclusion in medical education, advancing diagnostic excellence and effective communication around clinical uncertainty. In 2024, we're looking forward to continuing a lot of the work I've just highlighted, but also exploring some new work, including continuing our work with the Institute for Healthcare Improvement to explore organizational trust, amplifying the work of US-based health systems who have a core strategic goal of becoming trustworthy, building a community of researchers focused on trust with Academy Health, guiding our grantees to operate successful projects focused on advancing health equity, addressing diagnostic gaps, and developing curricula on communicating clinical uncertainty. Exploring work to foster public trust in the healthcare industry, including the role of medical debt and AI. And finally, welcoming a new Chief Executive Officer this time next year. Thank you for being a part of our journey. I'm really looking forward to continuing to build a healthier and more equitable future together.